Awesome. Okay, so our muting of the of every participant is also muting the host. So sorry about that, everyone. We're going to go ahead and do a reset on this little. Sorry about that, and if everybody could please mute their own individual phones, that would be helpful so we minimize background noise. Parker, let's go ahead and start with the home page. What we're doing is we do have the developing a FluFIT workflow, but we also wanted to demonstrate ordering of our online materials for the FluFIT program as well as the immunization resources. We're very proud of our moving into the 21st century, and Parker here is going to show us how that works. We'll run through it fairly quickly, but feel free to chat your comments into the chat box because we would love to hear your feedback about our procedure, and I also really encourage you to get these materials ordered because it's amazing how fast September is upon us. So go ahead, Parker. Take it away.
All right. Well, thanks for staying with us, everyone. I'll start back from the beginning. Many of you maybe saw what I was showing but could not hear my wonderful voice, so now you get to hear my voice. All right. So we're on the home page of Mountain Pacific Quality Health's website. If you type into your internet browser mpqhf.org, it'll take you to this page right here. And I'll show you how to navigate to the immunization tools and resources from here. So I'm going to hover over this Quality Improvement Organizations tab, and I'm going to select QIO Tools and Resources. Then I'm going to go to Adult Immunizations and FluFIT, this box right here. I'm going to select that. And so these are all the tools and resources we have for immunizations and FluFIT. We have 3 columns, webinars and videos. This will show all the different videos we have. We have a few videos on YouTube that you can view as well as some past webinars. Under tools, we have some posters, postcards, a flu button, and immunization records and some other tools. And then we also have tools and resources for FluFIT, specific for FluFIT. So I'm going to go through and show four of the order forms. We have a total of 4 order forms that you can order, either postcards, posters, our immunization records, or the I got my flu shot flu button. So I'll go through and show each of those order forms. I'm going to open them all up at the same time that I can navigate through them. All right, so the first one that I showed earlier with no audio was the FluFIT, or the immunizations and FluFIT postcards. So just really basic information: name, email, phone, facility. You have an option to upload your company logo, and we can place that on the postcard for you, as well as a mailing address as should appear on the postcard. We have 4 postcards right now that you can order, and I do understand these are tough to see, so we also provided a link to show each of the postcards in a higher res image, so you can see the information that's on those postcards. Those are right here. From here, you get to choose which postcards you would like, and with the select box here, I'm going to select all of the postcards and show you how that works. So once I select all of them, these boxes pop up with the quantity I want. So I'm just going to enter a few quantities in here, 50 each, and that will give me a total quantity at the bottom of 200. At that point, you get to choose whether Mountain Pacific will mail the postcards out for you. If you choose this one, Mountain Pacific will be contacting you very soon and to get a list of all the patients' names and their mailing addresses so we can send them out. You can also choose to have us send you the postcards to your facility, and then you can send them out yourselves. If you do select that option, it'll pop down a shipping address below. And then we have a thing that you need to select to say that you're not a robot, and hopefully you're not a robot. Google will pop up something, so when I play this, it'll play some numbers, and when I hear the numbers, I will enter them and verify myself. Then I will submit the order, and two of our people will get that email, and they'll be reaching out to you very soon. The next one I want to show you, the next one I want to show you is the immunization posters, and really similar to, let's see, that's not going to work if I.
Oh.
Just one second.
Okay.
All right, so from the immunization posters, really similar to the postcards, similar information. We have all the posters right here. Also, we have an image that you can click on and see a larger image of what that poster will be. This one's a little different. When you select these, we have a few different options. So once again, I'm going to select all of them. From here, you can select a different size of the poster, a regular 8.5 by 11 inch poster, or an 11 by 14 inch, or 11 by 17 inch. So you would select one of those, enter a quantity, and with the postcards, we do have a limit per facility. So the limit of the total number of posters you can order will be 75. So let's say I want 15 of these, 15 of these. I'm just going to enter this in so you can see how it works at the very bottom. All right, so if it gets down to here and there's more than 75 in the total quantity, then we just ask that you reduce the quantity in some of your posters, not increase. Let's reduce. And there we go. So now I'm at 75. I can click this button again and submit that order. Once you submit that order, someone will contact you very shortly and get that ordering process fulfilled. So those are the posters.
Okay, and just to interrupt you real quick, Parker, we do have a question in here about the cost. All of the resources at Mountain Pacific Quality Health are free, so feel free to take advantage of that and use the ordering procedure. If you do need more, as Parker noticed or talked about, you can download the image and then you can replicate any amount greater than the 75 for posters, and I can't even remember what our limit was for the postcards, but we sent out thousands last year, so we're good.
Yeah, so like Amber was saying, you can download that resource right on the Tools and Resources page. Just says download the PDF, and then you can click there and access that PDF right there. So posters, we do have a quantity limit of 75 per facility, but reach out to us if you need more, and I'm sure we can talk about that. For the immunization records, this is another one, really simple information, just your basic information. We have an image of the immunization record as well as an image of the front and the back of the record, what it looks like. We limit this resource to 75 per facility, so please enter a value one or somewhere between 1 and 75. Excuse me. Select that you're not a robot and submit the order. So that one's really simple. And the flu button, we have the same information. Have the image of the flu button. This is what the flu button will look like. Here's a larger image of the flu button. I got my flu vaccination. This one we ask that we're limiting it to 300 per facility. So enter a value between 1 and 300 and select you're not a robot to submit the order. So those are the forms that we've created for you to be able to access all of our resources. I'm going to go back and show you just briefly show this page again. So you can access those order forms under each of the tools that you see listed here. Under tools, if I wanted to access the posters, I can click order form for posters. Or if I wanted to download this specific poster, I can click download the poster, and you can print it off yourselves. So that's all I have today. Questions or?
Can you show the giraffe one?
Oh, the poster itself?
Yeah.
Yeah.
Just because that's the FluFIT one, correct?
I'm not sure if this is the
FluFIT
one.
No, that's not the FIT one. Okay. We do have a FluFIT poster on there as well, which is, there it is.
Yeah, here's a FluFIT poster.
Thank you. So, and if anybody has any feedback, again, like I said, we're always happy to hear your feedback on our resources, and feel free to download those and get your orders in. Okay, I think we'll go back to the regularly scheduled, yep, right there. Awesome. Okay, so I'll just get right into it. Great, thanks, Parker. We want to move ahead. Okay, there's me. Okay. So what we're going to do is just do a quick overview of the objectives. We're going to explain the different patient flows for if you're doing a flu clinic versus incorporating this into your clinic visits, your routine visits. Talk about rationale for why it's important to offer the FIT test before the flu shot. Discuss various clinic-based versus screening, I kind of already said that, and identify protocols to determine patient eligibility. Next. So why try FluFIT? Well, if you remember from one of our first webinars that we did in this series, nationally only about 66% of Americans are up to date in colorectal cancer screenings. Montana is the state I know the best, and we are significantly even lower than that. So one thing that you might want to do is set a nice goal for yourself. The American Cancer Society has a goal of having 80% of Americans be screened for colorectal cancer by 2018. So if you can commit to the 80 by 18, that would be awesome. If you have a specific goal in mind for your own clinic, feel free to place that into the chat box. And if you feel super brave, you can also state where you are now and what you hope this program will get you to. So that would be awesome. And I see that Emily is posting some resources into the chat box as well. Thanks for that. And then, so anyway, the FluFIT is a great way to start to incorporate all of those preventative screenings. Of course, when you do have multiple screening opportunities at one time, it's actually been proven that you have a greater uptake of both prevention efforts. So this, during flu season, is one prevention strategy that can help you in multiple ways. The other item that might be kind of interesting is for those clinics that might have a mobile mammography, or for those people that have mobile health clinics, flu shots are often a good mechanism to getting out there in the community, and we would love to have you include the FIT test in your mobile flu clinics. Just another note, if there are any FQHCs or people that have pharmacies involved in their health system, we would love to get some additional experience and talk to those people that could incorporate flu into their community pharmacy program. I know that isn't super common right now, but we would love to hear more information about that. Next. Okay, so to set up your FluFIT program, we've talked about some of these steps already. Putting your team together is probably the most important. Selecting a champion, if that can be a physician in your clinic, that is awesome. And then determine team members and staffing levels. Often this does not require additional staff. It just you just need to make sure that your staff is well trained. They need to understand the importance of both flu shots and the colorectal cancer screenings. They also need to understand how to talk to patients about the FIT test and how to complete the test itself. So some common talking points about the FIT test is simple, short, direct statements. Colorectal cancer can affect anyone, men and women alike, and your chances increase with age. Colorectal cancer treatment, cancer is highly preventable, treatable, and curable. Most people are very afraid of cancer, so knowing that cancer is preventable is a new message for a lot of patients. Screening needs to begin at age 50. Men and women both should be screened regularly. So those are some common talking points that you can have at your disposal, and you need to make sure your entire team is well aware of it. The other thing that's really important in training your team is record keeping and who is going to do follow-up and how they're going to do that follow-up. So those are things that we need to make sure that that is completed. And the www.cancer.org/colon/MD has some great resources, as well as flufit.org, and we've already highlighted some of those in our past webinars, and we'll have some additional ones in the next one as well. So next. So this is when to offer FluFit. So this is your screening guidelines. So this is a fairly simplistic. These documents are on both the flufit.org as well as the cancer resources. And so essentially, if the patient is 50 to 75 years old and at average risk, then yes, you could proceed with the screening algorithm here. If the patient has had a colonoscopy within the past 10 years, then they are excluded. If they have not had a colonoscopy or a CT colonography or Cologuard, which is, now I can't remember if that's 3 years or 5 years, but then offer the FIT test. And if you're interested in some details about the FIT test, then on our first webinar series, there was quite a bit of information about that. So you can go back to those resources. Next. It's almost more important to know when not to offer FIT testing. So FIT testing is for only average risk patients. It is not for those patients at high risk. So high-risk patients are those with a history of Crohn's or ulcerative colitis. If you have a personal history of polyps or cancer in the first degree relative of any age. So this is your parents, grandparents of any age. If you have actual symptoms, then you need to have a screening by a medical professional, a physician, which will likely be a colonoscopy at that point. Okay. All patients, all screening of the patient should receive general information about colorectal cancer screening and why it's important. This is true whether or not they receive a FIT test. So a patient may choose at that point to do a colonoscopy instead, and that is great. Another thing from our previous webinar series was just the offering of a choice to patients also helps them be more committed to that choice. So if they understand that they have a choice between a colonoscopy and a FIT test, they may choose one or the other, and they're actually more likely to follow through and actually complete the test, either test. We're offering FIT tests during flu season, number one, because it has a fancy name and it flows off the tongue so well, but secondly, because these are very low-cost prevention efforts. Many of the FIT test kits are, less than 20 bucks. So that is a very good economical choice for a lot of patients. Make sure that you explain the different screening options, and then reinforce that they can take the FIT test home today, or we can help you schedule for a different recommended test if you're going to look at colonoscopies. When offering the FIT test during a flu clinic or during a regular scheduled clinic office setting, it is really important to offer the FIT test and to talk about the FIT test first prior to giving the flu shot. Many patients feel like as soon as they've gotten the flu shot, they are ready to go out the door, and so it's just been kind of a very common thing for them to, after, I got my shot, I'm ready to leave. So make sure you talk about the FIT test first. It's also helpful to have, no, that's okay, to have a plan to know which patients to outreach to. So if in the ordering of your postcards, you could do some scrubbing of your data and ensure that those postcards are going to those that have an appropriate need for testing. I realize some systems are easier than others to navigate, but that is helpful to target your message. This is your FluFIT flowchart for a flu shot clinic. So it basically does the algorithm that we've already discussed, figuring out which patients are excluded from the FIT test because they've already been screened, and then it just walks them through the process. So, next. And then this is the reminder phone call flowchart. And so if the patient has not returned the test kit within 14 days, you have a much better chance of getting that FIT test returned if there is reminder phone calls. So it's important during the reminder phone call to give that same little spiel about colon cancer is preventable. Colon cancer is happens in society, and actually it's happening younger and younger according to some new statistics. So make sure that your whoever's doing the follow-up phone calls is understanding of the script, and then records the fact that the test kit was, or stated the test kit was going to be returned, and then go ahead and record the results in the patient's chart, and of course notify the patient of the test results. That is obviously the most important aspect of this. We do encourage you to not only push those, have a telephone call of reminder if it is, obviously if it's positive, that needs a personal one-to-one reach out to explain the significance of that, usually by the provider or at least by the care coordinator, but also push those results out through your patient portal and encourage the use of those patient portals in your actual workflow. Next. Okay, so in a clinic setting, you're going to have a mix of all different types of walks of life. And so it's important to keep those screening guidelines in a place where your staff can readily access them. So the first lady on the left, she's 30 years old. She does not get offered a FIT test because she's not within the age guidelines. The patient that's 86 also is outside of the age limits. So he is also not eligible for the FIT test. The other couple on the right-hand side, I guess that's the left-hand side. I don't know my right from my left. Anyway, they are, the gentleman is eligible for both flu and FIT because he has not previously had colorectal cancer screening, whereas the other patient is. So you have to have a well-trained staff so that they know which patients are appropriate and which patients aren't. The last thing that we want to do is encourage heavy screening and then have a denial from an insurance company because they've already had a screening. So it's important to know that. Okay. For the clinic-based versus screenings, if you're doing a flu shot clinic, it's important to advertise for a flu shot clinic ahead of time. Advertise ahead of time that you're also going to be offering colorectal cancer screening. Many of lay people don't know that FIT means a fecal sample, so make sure you state home-based colorectal cancer screening is usually a little bit more patient-friendly lingo other than FIT test. You might know what that is, but patients may not. So make sure that that's in patient-centered language. We think that our poster fits that. And if you have other resources that we can incorporate, we don't mind making additional posters, etc., that is helpful. And then also just, know the who, what, when, and where. What time is the event going to be? Where are you holding the program so that the public can access it? How to advertise. Some other more logistic kinds of things is, are you going to roster bill for these, or are these going to be free services? Or do you have a grant to do some of this stuff? So some of those logistics. And we are always happy to help problem solve. We have myself here at Mountain Pacific, Emily Coyle from the American Cancer Society, and we also have the folks at the state that are also very interested in increasing our colorectal cancer screening. So all of those people are at your disposal to talk through any logistics or problems that you might be having, and happy to help. Space is always at a premium on these. It's most helpful if you're doing a flu shot clinic to have a separate table that does the screening for the colorectal cancer screening first, and then proceed down the line. It's a little bit easier in a clinic because you have a captive audience of one in a office, office setting. So it's also quite helpful for the FIT test if you have a running loop of the video about how to collect the sample and maybe some items on there about colorectal cancer screening in the waiting room. Those are available on flufit.org. And if that's something that you would like us to develop, we'd be interested. We don't want to develop things that people aren't going to use, so, by all means, give us some feedback. And again, like we said before, always make sure that the flu shot is the last intervention before the patient walks out the door. I think we've already basically talked about that. Patient education materials, that's what we're here for. So download those and get those orders in. And then more on patient education. The FIT test, having the FIT test in your possession does absolutely no good if you do not return it to the clinic. So make sure that patients feel comfortable with that. Kind of de-emphasize the ickiness portion of it. It's really not that difficult. They don't have to get their hands dirty. There's a very nice, clean way of collecting those samples, and it is fairly simplistic. So there are, again, resources on flufit.org. And Sharon asked, does promoting FluFit count as an improvement activity? No, it actually is not listed as a specific improvement activity. But well, let me look at that. I'll have to send out a little note to everybody if I do find something like that. Go ahead, next. And then there's also American Cancer Society also has a lot of really good cancer materials, and so those are also able to be ordered if you prefer those. We're just happy to get the word out. And you can see what those look like, and Emily would have those resources available. And then this was a web page that was referenced earlier in our webinar here. And it actually is very easy to navigate, and it does talk about not only increasing colorectal cancer screening rates. It also has some information on increasing mammography and cervical cancer screening as well. So it is helpful. Go ahead. And then, of course, the other piece is that to inform patients ahead of time that if they do have a positive FIT test, they must receive a colonoscopy. This will identify the source of the abnormal finding, which is blood in the stool, of course, and a colonoscopy often can be paired with the actual removal of the polyp, which is then tested, and the polyp can be a sign of early disease. So those are removed, and the patient, in the best case scenario, has no additional treatment. If they've had one positive FIT test, they are now considered high risk, and they will have to have colonoscopies at a minimum of every 10 years. And often if they've had a positive one, the doctor will recommend a different screening cycle based on the extent of what was found. And then we will have more information about follow-up and how to encourage that in the next webinars. So next. Our last session is, well, actually, Dr. Michael Potter. He was the person that was instrumental in developing and testing the FluFIT intervention, and created all these implementations and resources guides. So we're very thankful to him, and hopefully you all can continue to preach the gospel, so to speak, about this, and get even more people involved in a very low-cost method of screening for colorectal cancer screenings, and obviously get your flu shot at the same time. Next. So, in summary, it is helpful to identify the staff that will work with flu shot or FluFIT patients. Ensure that they have the training that they need to speak comfortably about the topic. Determine just the workflow of your space constraints. Identify those patients that are eligible. Create a system for easy access to the patient's EHR, because often patients are forgetful about when they've had a particular test. They might have think they did the FIT test last year, and it was actually 2.5 years ago. Offer the FIT test for patients, and then ensure that there is appropriate follow-up as well. And I've said it like 3-4 times now, but make sure that you're offering the FIT test prior to the flu shot, so that they get that needed information before they exit the clinic. And that is all I have. We will open it up on the phone lines for any questions, and feel free to type into the chat box any feedback or questions that you might have. Just to reiterate that the resources that we showed earlier today from Mountain Pacific are totally free. If you need to exceed the limits that we've kind of discussed and are on the website, feel free to give us a call. We usually can work out something or assist in your own organization doing some of the printing costs. Any other questions about FluFIT? Anybody want to share some examples about how they've done their program, how easy the staff did the training, or any difficulties with staff training and commitment to the program. We would love to continue to learn from each other about how that works. I think next time we have one of these webinars, we're going to have a couple of plants in the audience so that we get the ball rolling with the conversation. So I will leave it at that and give you about 10 minutes extra in your day. Feel free to reach out to us, both Emily and Ian in Wyoming, as well as myself here at Mountain Pacific, and we'll be happy to answer any other additional questions that you might have. I do see somebody else is typing something, so I'll hang on a second. Thanks again, was good, great. Awesome. We're here to help. So with that, I'll let you get on with your day, and I'll talk to you soon. Thanks. Bye.